Okay, good evening and welcome, ladies and gentlemen. First of all, we would like to express our gratitude to you who is willing to make your time to such wonderful and meaningful program to this evening by North Borneo Wellness. Before we proceed to this session, we would appreciate that you would mute your mic along this session. If you have any inquiries, you can leave a message or voice out after this session. Allow me to introduce our speaker this evening, Ms. Kimberly Janet, who is a founder of North Borneo Wellness and will share about Buyer's Guide to Hormone Therapy, Estrogen and Xenoestrogen. Kim, if you may.
Okay, welcome back for especially Helen, you've been starting since the day one of this Buyer's Guide to Hormone Therapy, and also Sharon, thank you for your support, and also Chiu have come today, participate, and also Jenny, and okay, so before that, I would like to start this session, and I would like to ask all of you to actually join in one activity. So as you can see here, a review time for your previous session. So what you can do now is that you can participate through keying in the code 679328 at the my quiz, or you just scan the QR code, and then the game consists only 7 questions. So this is a game where it only recap for the previous session that we have on cortisol and DHEA. So if you are new, it's okay, just join in, and you can answer the questions accordingly. First question is that where is the cortisol being produced? So you can answer based on that. All right, so the answer is actually adrenal glands. So cortisol are mainly being produced in the adrenal gland. And next question, what is the cortisol level are normally at in the morning, and how is it at the evening time? Correct. So most of you answered correct. So they are highest in the morning and lowest at night. So when low cortisol, it will help you to sleep. So the next one is when cortisol are remain elevated, they are stored to use to prepare the body during in face of danger. So this increases glucose and fats in the bloodstream with high cortisol. Where will the stored hormones be? So which part of the body that cortisol will store on? All right, most of you answered correctly. It's actually on the belly. So belly absorb most of the glucose. Therefore, high cortisol will cause you big belly problem. Next, what are the symptoms that have diabetics and insulin resistant, excess facial and body hair, fatigue, anxious and depressed, heart disease, and increased cholesterol? So what are these symptoms for? Is it low cortisol, high DHEA, high cortisol, or low DHEA? All right. The answer is actually high cortisol. When you have high cortisol, you will have all these symptoms. The next question is, so DHEA are considered among other hormones. So what is it? Is it the master of the hormone? Is it fountain of youth? Is it the drivers of the hormones, or the messenger? This question a bit tricky. So what is DHEA? Right, all of you are correct. Yes, DHEA is actually the fountain of youth. All right, so which is the last question, will be the primary two causes of low DHEA are: is it chronic stress and overeating, too much exercise, aging and chronic stress, not being active, which is lack of exercise or active lifestyle? So which one is the two primary causes of this low DHEA? Yep. So it's like half of you answered correctly, which is the answer will be aging and chronic stress. All right, so let's continue. And thank you for all your participation. This is very interesting, and thank you for those who participate. Don't look at the score because we just wanted to review, and hopefully this will make you stick there. So let's continue on the talk here. All right. So today's topics will include what is estrogen, the types of estrogen, which is E1, E2, and E3, benefits of balanced estrogen, symptoms of high or low estrogen, what is xenoestrogen, sources of xenoestrogen, and how can we detoxify xenoestrogen, and case studies, and how is it related to breast cancer. So firstly, what we have to look at is estrogen has more than 400 functions, and it will affect every cell in the body, including your skin, hair, bone, heart, and brain cells. So it is actually classified as a steroid hormone, and estrogen is mainly known for causing the body to develop female characteristic. So it will do it during puberty. So it also balances the actions of the hormones, progesterone. So a woman's body will make up 3 types of estrogen, which is what we mentioned just now, is E1, E2, and E3. So how is these estrogens are produced directly by is actually by the ovaries and also other tissues such as body fat. So man's body also synthesize a certain amount of estradiol, which is estrogen is understandably found in much larger amount in women. Okay, so let's look at estradiol first. Actually, recognizing the symptoms of estrogen imbalance will certainly come in handy to women as we progresses the different stage of life, and there are understanding through 3 kinds of natural estrogen can provide even more help to throughout our menopausal or perimenopausal period. So the E2 is actually the strongest estrogen, where estradiol gives you feminine features and promotes youthful skins, thick hair, and beautiful curves. It also builds bone, encourages insulin sensitivities, decreases your LDL cholesterol, which is your bad cholesterol, and has many more benefits. It is also the major estrogens in your body during your childbearing years, which is meaning if you're having your first period that time, it's also already indicating that you are on your childbearing years until you're going through the menopause period. So a small amount of estradiol is converted from another type of estrogen called the estrone, which is E1. So the drawback is that there is an association with breast cancer if present elevated levels. So if too high of your E2 level, it might really related to your breast cancer. So the next one we'll look at estrone, which is E1. Estrogen has benefits like reducing risk of osteoporosis. So it's associated with breast cancer. So and it is found in fatty tissue and still made even after menopause. Typically from androgens like testosterone. So women who are overweight and have a high percentage of body fat, tend to experience fewer symptoms of menopause because their estrogen levels are high enough. Some overweight women, however, will find their body fat provides insulations that leads to a higher body temperature and therefore will result in hot flashes. Okay, and the next one will be E3. So the estrol functions are similarly to estradiol, but it is weaker and may be protective against breast cancer. So E3 is actually used as an anti-estrogen medication. So estrol occupies the estrogen receptor, which is receiving the receptor that receives the estrogen and taking the place of more potent estrogens. So some in the European countries, they actually use estrol as part of the breast cancer treatments, and instead of using the protocol of this medication, which is chemotherapy medication, namely tamoxifen. So another popular applications of estrol is to apply at the vaginal wall, where the estrol receptors are most abundant there, which can greatly alleviate the vaginal dryness. So one drawback is that estrol supplementation may add a couple of pounds onto your hips and your thighs if using too much of it. Okay, so the next one will be the role of the estrogens in your body. So in its role as the major sex hormone in your body, estrogen does some pretty important things that aren't related to fertility. So as a hormone, estrogen, mostly estradiol, acts on the part of your body that have estrogen-specific hormone receptor. So estrogen is involved with numerous important functions throughout your body. So first one, we'll look at sexual development. So estrogen is responsible for the growth and continued development of your reproductive anatomy, including your vagina and uterus. So it also responsible for the development of your breast and the growth of your pubic and armpit hair during puberty. So together, these changes signal the upcoming arrival of your first menstrual period, which marks the beginning of your childbearing years. So this is the signals that the estrogen will give to your body. And the next one, let's look at bone development and health. So estrogen plays an important role in the healthy development of your bone. So it regulates bone turnover in your adult years when protects against bone loss. So in menopause, when estrogen levels fall, women can experience a significant increase in bone loss because the protection effect of the estrogen is no more. Is gone, and the dramatic increase in bone loss can actually lead to osteoporosis, which puts you at a greater danger risk for a hip fracture. That's why most of the women who already menopause, they experience a very fragile bone, or even they fracture their bone easily because there are lack of estrogen in their body. Okay, the next one, let's look at the heart health. So on heart health, estrogen helps protect against heart disease. The hormone does a lot of good things in your body to keep your blood vessel healthy, including decreasing inflammations and controlling your cholesterol levels. Taking all together, the positive effects of estrogen on the prevention of heart disease is significant in premenopausal women. So in menopause, when the protective effect of estrogen is gone, same thing like the bone, there is a steady increase in heart disease in women. So in fact, the complications of the heart disease are the leading cause of death in women, which is research in United States. Okay, And the last one will be the mood management. So estrogen has a pretty significant effect on your brain. So it is thought that the estrogen affects how your brain are structured, are connected. So how your brain cell communicate and even the shape of your brain. Additionally, estrogen plays a big role in your mood because it has a very strong effect on brain chemical called serotonin. So serotonin is actually a mood balancing chemical and estrogen promotes its productions. So without estrogens, your serotonin levels will actually drop. That means the effects of this is very significant in some women. So it is thought that this low estrogen actually related to drop in serotonin production contributes to postpartum, which is after they give birth to the babies, and menopausal depression. So why depression happens on most menopausal women is because of this estrogen level drop. All right. So estrogen levels can be too low, particularly as a woman approaches menopause, so leading to a variety of symptoms and health problems. So if you experience more than half of these symptoms, you might have this problem, which is low estrogen. So as you can see, most of the symptoms here are on bone loss, decrease of skin tone, dry skin and eye, having headaches, heart palpitations, hot flashes, insomnia, or daytime sleepiness. Mostly is when they are having menopause, they also experience leaky bladder, light and no period. Of course, after menopause, you won't have period, low sex drive, memory loss, and brain fog. So all this will affect your body. So if you suspect that you might have a problem with your estrogen level, hormone testing is a great way to confirm whether your levels are not optimal. However, if you can consume food that contain phytoestrogens, which are plant-based substances that resemble estrogen, some studies suggest that these might affect your estrogen level. It can help to increase your estrogen level, but is actually not enough evidence to confirm this yet. Some people say that if you eat too much phytoestrogen, you can actually lead to breast cancer, but this is plant-based, so it's actually safe to consume. And what is it includes is that cruciferous vegetables. So what is cruciferous vegetables is broccoli, Brussels sprout, radishes, cauliflower, watercress, turnips, kale, cabbage, rutabaga, arugula, colabi, and collard greens. So all these are in the category of cruciferous vegetables. And soy and some foods containing soy products, but not isoflavone, and berries, seeds, and grains, dry fruits, wines, tofu, and tempeh. Tempeh is actually made from fermented soybeans. Okay, so next, if you have if you have high estrogen, these are the symptoms from the estrogen dominance, particularly found in women during adolescence and at the onset of menopause, which is called premenopausal. So the following are the symptoms of women experiencing a very high estrogen levels. So mostly what I experience is that women who have estrogen dominance usually feel their breast tenderness, and they have very cool body temperature. For example, they have cool hands and feet, and mostly they have fibrocystic breasts, hair loss on the scalp, headache, and irritable mood, which is when you have too much mood swing. So that will affect also symptoms for your high estrogen level. Okay, so all this you can see that when you have more than half of this problem, you need to go and do a test where it is likely that you might have this kind of estrogen dominance problem. So what's causing the high estrogen, which is also known as estrogen dominance, is that this is also a research in America where they they also mentioned that women tend to experience this imbalance most often is that they are likely to eat a diet that is low in fiber and high in fats. But high in fats doesn't mean that it's high in good fats, which is they eat low in omega-3 fatty acids also. And they don't exercise regularly. So it may also be due to the elevated exposure to estrogen mimicking substances, which is known as xenoestrogen, which this can wreak havoc on your health. So what is xenoestrogen? So not many people know what is xenoestrogen, but xenoestrogen are the foreign estrogen, which is something mimicking estrogen and being introduced to your body. Okay, so it can bind the estrogen receptor sites with potential hazardous outcome. So in a summary is that xenoestrogen is like a wolf in sheep's clothing. Okay, then they can still bind to a cell estrogen receptor but confuse the cells by giving them a different messages. Over time, they can lead to cancer by telling the cell to multiply too often. They may also promote allergies and infection and affect reproduction, metabolism, and stress tolerance. So whether the breakdown of estrogen produces useful or harmful metabolites depends on a person's genes, exposure levels to toxins, and their liver health. So this is affect most how it actually have more xenoestrogen in your body. So not all xenoestrogen, however, come from the body's metabolism. Others are created by your lifestyle and daily exposure to certain outside substances. So let's see what is the sources of xenoestrogen. It is important to recognize all sources of xenoestrogen and avoid them whenever possible. If you're regularly exposed to these following substances, your body may already be dealing with the effects of xenoestrogen. So first is those who are taking birth control pills and having too much caffeine. Actually, 1 cup a day is still considered okay, but more than 1 cup, it will be a problem. And cosmetic, which is having all the parabens, PEG, sodium, sulfate, and also they have other kind of ingredients that might harm our skin and body, which is introducing heavy metals in our body. Other than that, chronic consumptions of alcohol, which is you don't drink it in a social term, but you drink it regularly, which is every night maybe you have 10 cans of beer, and that will be a very huge problem, not only for your body, but in the same time your brain. And this also have, other than that, is a conjugated equinestrone. What is this? Estrogen medication that is usually used for menopausal women. Most of the famous brand is called Premarin. And the next one, if you like to have food microwave in a plastic container, this also will introduce xenoestrogen in your body. And process of high fat food also, or you drinking tap water directly without a filter, is also introducing xenoestrogen in your body. So other factors such as lack of exercise, obesity, smoking, and stress also promote xenoestrogenic activity in the body, which leading to overload of toxic substance. So too much of this toxicity in your body, the liver becomes overwhelmed with xenoestrogens, and its ability to dispose of this hormone mimickers is negatively affected, which can result in toxic buildup. So all this problem will be heavy metals poisoning soon. All right, so how do you want to detoxify this xenoestrogen? Is that if the accumulations of xenoestrogen is suspected, it may be helpful to measure the level with a saliva test that is available in Malaysia. So which is in KL, is available. I'm not sure in KK, and I can ask a doctor for that. But however, saliva test is the most accurate test, and if the results are positive, you may be able to lower the amount of these toxins in your system by taking an extract, which is a hormone medication called DIM, which is DIM. Okay, so DIM is actually an indole tricannabinol, which facilitates eliminations of xenoestrogen. It's a substance that binds, which is combines to the xenoestrogen, and it will be detoxified from your body through urine or through your feces. So prescription of this, usually this DIM can also be found in foods such as the broccoli, cabbage, Brussels sprout, and cauliflower. So you can eat this kind of food to detox, but you must eat a lot in order to fully detox the xenoestrogen in your body. Therefore, some people seek help in terms of getting prescription from the doctors through recommended dosage, where the doctor have to look at your test, then doctors will prescribe the dosage that you needed. But usually, through experience, a month of DIM at 150 to 300 milligrams daily should produce benefit, but ongoing supplementation may be better. So a follow-up saliva test will help to determine how to proceed. So at a therapeutic dosage, DIM can cause headache and sometimes a rash of the first few weeks of use, but these go away as the estrogenic toxins are cleared out. So it is recommended to use DIM in men and also for women. As they age, men can develop high estrogen level and often due to xenoestrogens. Taking DIM can lower the amount of these toxins in man's body and possibly even relieve associated prostate issue. So this also can help the prostate problem. So sometimes doctors also prescribe DIM with milk thistle, which is a liver detoxification herbs that goes hand in hand with DIM. And if you have used this therapy to rid your body of xenoestrogens, it is especially important that you undergo a 3-week course of milk thistle to clean out your liver. Usually is 220 milligrams of milk thistle 3 times daily for 3 to 4 weeks. So once you go on to the course, you actually will feel the benefits. So you can find this product over the counter at most pharmacy, and if you wish to purchase from us, you can do that as well. So what kind of other supplementation that you can help to have get rid of this xenoestrogen buildup is that it includes soy isoflavones, flaxseed, omega-3 fatty acid, methionine, magnesium, vitamin B2, vitamin B6, vitamin B12, folic acid or folinic acid, which is a more stronger substance of folic acid, glycine, glutamate, rosemary, turmeric, and antioxidants such as vitamin C, vitamin E, and glutathione and melatonin. But usually if you wanted to have a strong effects of liver detoxification, doctors usually recommend the glutathione. It not only will help you to detox your liver, but in the same time will give you a very nice skin. Yeah, I mean Philippines usually use glutathione to whitening their skin. Yeah, but that's not the effect. It's actually a side effect from getting this glutathione. So if you're having too much trouble on choosing all these kind of supplements, your doctor can help decide which supplement would be best for your situation. So while supplements can help your liver to detox, you still need to control your diet and lifestyle to maximize xenoestrogen exposure. So try to avoid anything that contributes to the problem. Eat whole food, not processed food, which is, okay, some people will ask, what is whole food? Whole food is something that you still can recognize the original shape of the food. For example, a broccoli. When you cook the broccoli, it still looks like a broccoli, right? So like, for example, a sausage. So a sausage comes from maybe chicken, maybe beef, right? So does it the sausage shape, is it still look like a beef? Is it still look like the chicken breast or maybe other parts of the chicken? No. So that is called a processed food. And you should choose whole food that are rich in protein and omega-3 fatty acids, for example, flax seeds or fish oil, and free from chemicals, which minimize the intake of omega-6 fatty acids. You need to exercise regularly and don't microwave your food in plastic containers. Limit caffeine and alcohol consumption, stop smoking or being exposed to smoking, and drink clean filtered water. You may well experience one's other benefit by adopting these changes, like a shrinking waistline or a more restful night's sleep. Okay, so lastly, let's look at how estrogen dominance linked to breast cancer. So xenoestrogen contribute to estrogen dominance. So your hormones are not your enemy. However, xenoestrogen most definitely are harmful to you. So the most severe consequences of long-term estrogen dominance is actually cancer. So for women, this can come from in the form of uterine, which is what are the form of cancer that will come to your body if you have too much xenoestrogen, is that uterine cancer, ovarian cancer, thyroid or lung cancer, or even which is what we know is breast cancer. As with most form of cancer, no two cases, which is there are two cases of breast cancer that are not exactly the same, because breast tumor behavior can be especially complicated and unpredictable. Cancer is really not predictable type of disease, and the type of breast cancer treatment a patient receives and potential outcome will depend in large part on a specific markup of the breast cancer cells. So normally healthy cells, some breast tumors contain receptors for the hormone progesterone and estrogen, which sends the signals to the cells promoting continued growth. Sorry. So approximately 2 out of 3 breast tumors are hormone receptor positive. So if you have ER positive, which is estrogen receptor positive, receive signals from and can grow when exposed to estrogen. Progesterone receptor positive, PR positive tumor receive signals from and can grow when exposed to progesterone. So meaning is that if you have estrogen, this estrogen receptor positive will absorb more of the estrogen. If you have PR positive, which is progesterone receptor positive, and you taking progesterone, it will absorb more of this progesterone on the tumor. So breast cancer tumor that do not contain receptor for either estrogen or progesterone are known as hormone receptor negative. So hormone therapy can be used to treat receptor positive tumor and can support in lowering the levels of estrogen and progesterone in body. So while blocking the hormones from signaling continuous cell proliferation, which is the growth in the tumor. So how do we how this hormone related breast cancer risk, how we going to prevent it, is that some breast cancer can be hereditary and result from specific gene mutation, which is known as BRCA1 and BRCA2 genes. So some people doing gene because now I think quite famous, they do saliva testing for the gene, and then they trying to find out what type of cancer they potentially have. So usually they will look at BRCA1 and BRCA2, which is more specific to their breast cancer. So genetic and hereditary factors typically accounts for as little as 5% to 10% of all breast cancer diagnoses. So due to the relationship between estrogen and certain types of breast cancer, there are certain risk factors and lifestyle modification that women should be aware of in order to understand and how to prevent this breast cancer risk as much as possible. So they have to be have a precaution how their lifestyle should be in order not to have this breast cancer. Therefore, some might use drugs that block the estrogen, which is what I mentioned earlier. They're using tamoxifen, which is quite is the protocol. If you have breast cancer, they will use these drugs to which is also known as chemotherapy pills, to actually stop estrogen from connecting to the cancer cell and telling them to grow and divide. So while the tamoxifen acts like an anti-estrogen in breast cells, it acts like an estrogen in other tissue. So it doesn't mean that it blocks the estrogen in the breast, then you don't have estrogen in other parts of body. You still have, but not in your breast. Okay, so it's called the selective estrogen receptor modular, which is SERM. So it can be used to treat women with breast cancer or who have not gone through menopause. So the fact is that the side effect of this SERM approach is that they might have experienced hot flashes and vaginal dryness or discharge, depends on individual exposure. Some women with cancer spread to the bones and may have tumor flare with bone pain. So this usually decreases quickly, but in some rare cases, a woman may also develop a high calcium level in the blood that is very hard to control. And if this happens, the treatment may need to be stopped for a time, and because it won't work if the calcium level in the blood is too high. And of course, there are a lot more treatments that can be approached by patients, but this is the most common approach that had been prescribed by health practitioners today. So factors such as the age of the woman starts menstruating and begins menopause can increase breast cancer risk. So an earlier period and later menopause expose the body to estrogen for longer periods of time, for example, increasing cancer risk. So to be safe, you can do self-examination at home by doing these following steps. So all you need to do is to repeat these steps once a month and always stay aware about how your body progresses along with aging. So once a month, you can do this test. And if you found out this kind of symptoms or signs on your breast, you need to do further testing in a hospital, which is hospital nearest to you. So let's end this session here today, and hopefully you learned a thing or two about estrogen and xenoestrogen. And let's build up this awareness and help me to reach out to the public via the power of networking. And I would like to ask for your support by sharing my session to your friends and family, and hopefully we can spread this awareness and help more people in our life. So thank you everyone. Hope you have a great session today. Thank you.
Okay, thank you everyone. Thank you Kimberly for sharing this session. So I shall leave this session a little bit, few minutes, maybe like a Q&A. Is there anyone who would like to ask or inquire some questions to Kimberly, perhaps?
Yep, if you're not able to talk, you can just type in the chat.
Or simply you can just DM her instead also if you feel shy, no problem.
Yep. Or is it too personal, then you just DM me. Yep.
Okay, so I think that's the end of the session, I suppose.
Thank you, everyone.
Right, okay. Thank you everyone for participating, yeah? Right, see you in the next session. Good night.
Good night, everyone.